to explicitly ask, I really care about you, and I'm just wondering, are you thinking about suicide?
This summer, Clemson University is expanding its mental health training on campus. They're extending it to the athletic department now. They're calling this the Tigers Together Initiative, and it's a program that educates all the staff about the warning signs of suicide and how to prevent it. 7 News reporter Kirsten Glavin is joining us here with the very latest on what they're doing. Kirsten.
Yeah, well, Amy, this program has been around for a few years thanks to a grant, but this is actually the first year Clemson is taking on the cost alone to make sure their staff is properly trained. Many faculty members have already been, but this summer coaches and other people in the athletic department will get the training that could save a life.
Every college student has their stresses. Student athletes are no exception, with pressures coming from beyond the classroom.
They're always wanting to be their best in the classroom and on the field with their sport.
That's why Clemson University is making sure no one is forgotten when it comes to mental health, especially those athletes. This summer, coaches and others in the athletic department will be trained on suicide prevention tactics and education as part of their Tigers Together initiative.
This type of training is critical for not only athletics, for athletic leaders and coaches and trainers and student athletes, but anybody on our campus, because this could be a matter of life and death.
Suicide is the second highest cause of death in college-age students, according to the American College Health Association. Last year, about 7% of Clemson students reported having suicidal thoughts. That's less than the national average, which is 12%, but that doesn't mean students aren't struggling.
But it's still about 1,600 students, and so definitely an issue that we want to tackle.
Although Clemson University wouldn't comment about how many suicides they've had on campus in recent years, we do know that the number of students referred to seek help for different crises and hardships has skyrocketed. In the past 6 years, the number of referrals from faculty more than doubled. According to a university spokesperson, the university had to triple their staff of clinicians over the past decade to keep up with that growing need for help.
What we're trying to share with this community, with the Clemson community, is that it's okay to not be okay. It's okay to be struggling with things, and it's okay to get help.
And the goal is to have this training begin in July and wrap up by the time school starts in August.
So this is